Hi, welcome back to Therapy to the Point. I'm Jeffrey, I'm a licensed therapist, and in today's video I'm going to go over how to treat obsessive compulsive disorder, also known as OCD. Obsessive compulsive disorder is a psychiatric disorder that consists of obsessions and compulsions. OCD can be really debilitating for a person, and this is because it causes the person to lose a lot of time performing these specific rituals. So the purpose of today's video is to help you or help someone that you know that has obsessive compulsive disorder alleviate some of these symptoms. Disclaimer, please use the following techniques with the help of a licensed clinician. OCD is categorized of compulsions and obsessions. An obsession is an intrusive thought that is telling the person to perform a specific ritual to try to eliminate an urge. Compulsions are the behaviors that somebody does to try to eliminate those intrusive thoughts from happening. So an example of a compulsion would be to actually check the front door, wash your hands more thoroughly, or double check that the oven was turned off. The difficulty in OCD is that this ends up being an endless loop, meaning that someone has the intrusive thought, they perform the behavior, then again the intrusive thought arrives, then the behavior repeats in a never-ending cycle. So how do we actually treat this? So I'm going to give you a step-by-step process using cognitive behavioral therapy to be able to treat obsessive compulsive disorder. The first step to overcoming OCD is to really try to identify the underlying fear if we don't perform a specific compulsion. Let's say that your intrusive thought is, did you really check the door? In order to identify the fear, ask yourself, okay, well, if I don't perform the behavior or the compulsion to check the door, what bad thing could happen? In this case, it might be, well, somebody's going to break in and they're going to hurt me and my family. Another example of this would be, let's say that somebody has the compulsion to not step on a specific line. Then you want to ask yourself, okay, what terrible thing is going to happen if you step on the line? And you might say, well, I'm going to get really, really hurt if that happens. So you really want to identify the underlying fear. The second step after you identify that underlying fear is to be able to respond to that underlying fear using a rebuttal technique. So once you identify the fear, what you want to do is you want to be able to learn how to respond to that fear. Let's say that your underlying fear is that if you touch the line, that something really bad is going to happen to you. So you might want to respond to that by saying, if I do step on that line, actually nothing bad's going to happen. I'm going to be okay. My family's going to be okay. Everything is going to be fine. You may need to repeat this several times to really ingrain it and really genuinely believe it. Once you have been able to respond to your underlying fears, then you want to be able to do this last step, and this is probably the hardest step of all. Whenever you do a specific compulsion, typically the anxiety goes down. However, typically the anxiety grows in the long run. So what we want to do is actually do the opposite and experience the anxiety in the short term. Experiencing this short-term anxiety is going to relieve the anxiety in the long term. This means not performing the specific compulsion and learning to be able to tolerate the anxiety in the moment. And I understand this can be super difficult. To somebody who doesn't have OCD, this is like having an itch and not being able to scratch it. It must be extremely difficult. However, this is the way to truly heal. So whenever you're having that strong feeling of anxiety because you haven't performed a compulsion, the key to it is to sit with it. And over time, the intensity of that feeling is going to go down as long as you do not engage in the compulsion. That's the 3-step process to overcoming OCD. That's it for today's video. Thank you for watching. If you liked this video, make sure to give it a thumbs up. And for more content like this, make sure to subscribe to my channel. Thank you, and see you in the next one.